हेलो, नमस्ते, आदाब। आज हमारे साथ हैं अपोलो हॉस्पिटल के डॉक्टर अंकित विजय अग्रवाल. He is a gastroenterologist and a hepatologist. Gastroenterology is that field of medicine which deals with diseases relating to the stomach, and hepatology is that field which deals with cases of the liver. So, sir, आप ज़रा बता सकते हैं why did you choose medicine as your profession?
Uh, See, it was very easy for me. As a child, I always saw both my parents are doctors.
Okay.
Okay, and as a child, I don't know why I always felt that I wanted to become a doctor. There was no pressure or there was no force from anybody, but I always felt that I should become a doctor. I should be there for the needy patients, and I should do well for the society. So that was my basic thought into my decision to become a doctor in life.
So, why did you choose gastroenterology and hepatology as your specialization?
A lot of different reasons actually. Okay. There was one senior doctor who I know who is also a gastroenterologist. So he was sort of an inspiration for me.
Okay.
Then gastroenterology and hepatology. When I finished my MD, it was like an upcoming specialty, and it has a lot of apart from a physician's mind, it also requires you to do a lot of endoscopic procedures.
Okay.
So that also was something which I felt was exciting, and there is also a lot of scope for advancement in the field.
Okay.
That is the reason I chose gastroenterology as a specialty for my career.
Sir, over these many years, have you seen any changes in trends in terms of diseases which are coming up in gastroenterology?
See, definitely we've seen, I've been practicing now for over 10 years, and I've seen that there's a lot of difference in the patients that are coming to us. Earlier, there was a lot of patients who would come with genuine or organic causes like, hepatitis B or C related liver diseases, or patients who had, proper GI conditions. But now we see that a lot of patients are coming to us with lifestyle related disorders. Okay, due to excess of consumption of junk or saturated foods, or excess consumption of alcohol, stress. So lifestyle related disorders are definitely on the rise, and that is what we are seeing more in our day to day practice. That's all.
Okay. So, what was some of the most challenging case you have come across? And would you be at liberty to share that with us?
See, every case is challenging.
Okay.
Some cases are more challenging, some cases are less challenging. The challenges are different for each case. In some case, the challenge is to get to a diagnosis. In some case, the challenge is to do a treatment option. And in some case, the challenge is to explain it to the patient or their family as to what the problem is, and if at all there is a treatment or there is no treatment. Generally, having younger children and pregnant women are more challenging cases, because there is a lot of other issues that come into the picture. So that's about the challenge. Every case is a challenge these days.
Okay, sir. I'm seeing on social media nowadays this word gut health is being thrown around and is being overused. So, could you please speak something about that gut health?
You put it right that there's being the word gut health is being overused quite rampantly. Okay, sometimes for I feel for commercial benefits. Okay, gut health is important, but you don't need to take some high-fi foods or super foods or super probiotics to maintain your gut health. What is important for gut health is to maintain a healthy lifestyle, to eat healthy, to avoid taking unnecessarily antibiotics and other medications, to eat on time, and to have adequate rest. So I think these are all that is needed for a good gut health. But unfortunately, on social media, you're seeing so many advertisements for different types of diets, different types of probiotics, different types of prebiotics, and so on and so forth. But in reality, it is just that maintaining a few good habits is all that is needed for a good gut health.
And I've seen a lot of these challenges: reset your gut in 21 days, and have this probiotic, take that, cure IBS, cure constipation, 21 days. I mean, is that a fad, or Wait,
It is just a
what is your view
fad.
on
It is
that?
just a fad, and it is just schemes that are run by different companies.
Okay.
Okay, I don't see a doctor or anybody or a gastroenterologist do that. These are just commercial programs that are being run. What is important, or what we have to realize, is that gut health is not something that you achieve in 20 days, or
Okay.
not something that you lose in 20 days.
Okay.
It is something that is there over time, and that is something that we intend to have for our whole life.
Okay.
So you don't follow a few medicines or a few things that make your gut health good in 21 days, and after that, again, if you're going back to a bad lifestyle, so that's not going to solve the purpose.
Okay.
It is to inculcate good habits, a good lifestyle, and to continue that for a long period of time, which will make sure you have a healthy gut and make sure you have a healthy life.
So could you give some recommendations on how to maintain a healthy gut?
I've already spoken about it. A good gut or a good lifestyle is very important. It is important to eat good foods. A diet which is having a good mix and match of good carbs, fats and proteins. Fresh fruits and vegetables should be there. They also have good antioxidant qualities. Having natural probiotics like curd definitely helps. We also need to avoid things which are not good for our gut, like excess of alcohol or smoking, which is not good. Junk food or processed food or foods which are very high in oils or fats or sugars are definitely not good. Once in a while everything is okay, but if being done in excess, it is not good. At the same time, given the current monsoon season, eating at unhygienic places, or the street side food like pani puri and other things is definitely not advisable, and it can affect your gut health. And at the same time, avoiding improper or self medications with antibiotics that we're seeing a lot post COVID is something that, if avoided, will maintain and make sure that you have a good gut health.
So people with food sensitivities and allergies, it becomes very difficult for them to manage, and they're more susceptible to diseases like gastroenteritis. Gastroenteritis only. Yeah, gastroenteritis. If I'm not wrong. What would you suggest to those people?
See, food allergies are common, but not as common as people think. Okay.
Okay.
A lot of people come to me and say that, I'm allergic to wheat or I'm allergic to milk and this, but there is no definite basis for it. So important is, if you suspect you have an allergy to a particular food, you need to consult your doctor about it. Okay. You need to get tested, and then if there is a treatment for it, you take a treatment. If sometimes there is no treatment, the only thing that is recommended is to avoid that food stuff. Generally, food allergies are taken for 5 or 6 common foods like milk, eggs, nuts, wheat, and seafood. Okay. So, if any of these allergy is there, it is important that you know that you are allergic to it, and the best treatment for it is to avoid that food. Okay, especially when you're eating outside, you have to make sure that what you're eating is not does not contain what you're allergic to, and hence it is important to read the labels, and it is important when you're eating outside to talk to the chef that I have so and so issues, and hence it should avoid the allergens is there. And nowadays, that is the reason you see that a lot of restaurants have menu where they mention, like might contain nut or egg or fish. That's basically for allergy purposes.
Okay, so thank you so much. Could you tell us what a day in your life looks like on a normal day, on a weekday, and also weekend, if you don't mind?
See, I have a quite a busy lifestyle. I get up early and I help my daughter get ready for school, and then I go to the gym myself, and then I get to work by 9 o'clock. And as a gastroenterologist, since our work involves doing endoscopies and other things which are basically done in a fasting, so patients, our work day starts early. So we do our work includes mix and match of OPs, seeing patients, doing endoscopies, and doing ward rounds and other procedures. Okay, so that continues throughout the day. I'm busy till evening, maybe till 8 o'clock or something, and that's what it. If I get some time, I have to read, because we have to be updated with what is going on currently, see videos of new endoscopic procedures, to learn new tricks, and also to read the latest journals to know what is going on, because there is new research coming every day. So that also is very much important for us to learn. Weekends are generally busy with family, okay, and that's a Sunday, that is. I generally avoid any personal or any professional commitments on a Sunday, and I make sure I'm giving my time to my family on a Sunday.
It's important to have that work-life balance.
It is definitely important, that at least one day we need for ourselves and our families.
True, true. So, what do you think are the future trends in gastroenterology?
See, the future trend is very clear that, in gastroenterology, the diseases that we're seeing are going to be predominantly lifestyle mediated diseases. We are definitely seeing an uptick in alcohol related liver diseases, in, lifestyle related diseases. Fatty liver disease has gone up quite significantly.
Okay.
These are things that we're seeing commonly. IBD, inflammatory bowel disease, was not very common in India maybe some 10, 20 years ago, but it's become quite common. That's again, I feel, is because of the westernization of our diet. In treatment wise, we have been able to, you know see a lot of advances in our endoscopy systems. So I'm thinking, in future we will see artificial intelligence being used in our endoscopy systems, so that, we are able to provide results quickly, get a better diagnosis, and also do a lot more procedures in a less invasive way to benefit our patients.
Sir, can you give some tips on for people, common day, just normal people, how can they maintain their liver health if they have a drinking habit, or they drink once a week or twice a week? I've also heard that one glass of wine every night does not do any harm. Is that true or?
Definitely not true. Okay, there are permissible limits that are, written in our literature. Okay, that one drink a day, less than one drink a day is what they say is a permissible limit. But it is always better to keep alcohol to a minimum.
Okay.
Okay, occasional drinkers, those who drink maybe once a week or once a month, if in moderation, is definitely good. The issue with alcohol is that, it increases. It will never decrease the amount of alcohol you're drinking. One, the kind of food that is consumed with alcohol is usually the unhealthy form, the fried food or the masala that people like to eat. That also contributes. So for a general person who wants to maintain a good liver health, important is to cut down on their alcohol intake. Important is also to do not take unnecessary medications, no over the counter medications, no antibiotics, no of these, a lot of medicines have been, projected as immune boosters or, health supplements. Do not take any of these without consulting a doctor. Make sure you're tested for hepatitis B and hepatitis C, because there is treatment available for both of them, and hepatitis B is a vaccine preventable disease. Safe sex practices are very important, because hepatitis B and C both can spread through sexual intercourse. At the same time, also is to avoid needle abuse. Okay, and if you're getting a tattoo, make sure you're getting it done at a good place, because these are all the things which can infect you with hepatitis B or C. So in India, the most common causes of liver disease apart from alcohol are hepatitis B and C, and then we have the fatty liver component. So for fatty liver, I've already talked about, is to maintain a good diet, have a regular exercise, avoid junk food. That is all that is needed. And if you have diabetes, hypertension, or cholesterol, make sure they are in control.
So, can you give some tips for stress management?
Ah, stress management is not so easy as it thinks, but it's very simple in a few ways also. Reducing expectations, making sure we stick to our schedules, giving time to ourselves, and cutting down on a lot of social media and screen time. I think these are a few simple steps that can definitely help us to lower our stress. Okay, but I think if somebody needs more professional help, then we do have psychiatrists who can help them on stress management.
Okay, sir. I've also, they say that the gut is the second brain, and if the gut is healthy, we can do our things properly in a proper way. Go in a disciplined manner.
Yes. Yes, it's true. Okay, there is a bidirectional communication between the gut and the brain, which is known as the gut brain axis.
Okay.
Okay, so there is communication between the two of them. Our gut is the largest store of serotonin in our body, so that's the feel good hormone. Okay, so that is the reason, if you have a good gut health, if you have a good discipline with relation to your gut health, you will definitely do well. Because somebody who has frequent digestive issues, or somebody who's having chronic gastric issues, they definitely will not be able to work to their 100%. And that is the reason, they need to make sure that their gut is in good health.
So if you want to increase your 2x your productivity, your gut health should at least be 4x. Okay, sir. Is there any advice that you would like to give to any young doctors who are aspiring or who want to enter the field of gastroenterology?
See, they are always welcome. Gastroenterology is an ever increasing branch. We're seeing a lot of specialities. We're seeing a lot of subspecialties coming up in gastroenterology also. People are specializing to only liver, or only pancreas, or only endoscopies, or only advanced endoscopy. So there is definitely a lot of scope. Okay, but whatever you're doing, my suggestion to young doctors is to do it with dedication, and make sure it is whatever you're doing is in the best of interest of the patient.
Okay, sir. So is there any message that you would like to give our audience?
See, my message to the general public, to the audience here, is that to not worry too much about gut health, or not worry too much about digestive and liver diseases. Important is to stick to the basics: healthy food, healthy lifestyle, regular exercise, avoiding things that can damage your gut health, and to stick to the basics for a long period of time. There is no need for any hi-fi diets or hi-fi medications. Consult your doctor, a gastroenterologist, whenever you have some red flag or alarm symptoms. Okay, so these include uh, loss of appetite, weight loss, frequent or recurrent vomitings. If you notice blood in your vomiting or blood in your stool, if you're noticing a black color stool, if you have new onset GI symptoms after the age of 45, or if there is a family history of GI cancers. So these are known as red flag or alarm signs. So if you have any of these, consult a doctor at the earliest. If not, simple medications should generally do well for you.
Thank you so much, sir, for coming on our show. It was a very informative session.
Thank you so much.